Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a presentation by Dr. Marcus Lin on the topic of digital screen overexposure and eye health. You now have 90 seconds to go through the questions.
My name's Dr. Marcus Lin. Today I am talking about digital screen overexposure, a modern health concern that's becoming increasingly relevant in our technology-driven world. And that probably explains why, among our patients, there's a growing number of complaints about eye strain, headaches, and blurred vision, yet very little understanding of what's actually happening to their eyes. This gap arises from the automation of using screens in daily routines, processes such as work, education, and entertainment. It is our responsibility as a healthcare professional to provide the explanation of what digital eye strain is and its consequences very clearly, and why it matters, starting from basic human physiology. The human eye wasn't designed to stare at bright, close-up screens for hours on end. When we focus on screens, especially at short distances, for prolonged periods, the eye muscles remain in a constant state of contraction. This leads to symptoms like eye fatigue, dryness, blurred vision, and even neck and shoulder pain, a condition collectively known as digital eye strain or computer vision syndrome. Blue light emitted by screens can also disrupt circadian rhythms, making it harder to fall asleep at night. While blue light doesn't directly damage the retina at typical exposure levels, it does interfere with melatonin production, which is crucial for sleep regulation. We often explain to patients that it's not just the amount of screen time that matters, but how they use screens. Using terms like visual ergonomics helps patients understand that posture, lighting, screen distance, and blinking frequency all play a role in eye comfort. We recommend the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for at least 20 seconds. This simple habit can significantly reduce eye strain. Additionally, adjusting screen brightness, using anti-glare filters, and ensuring proper ambient lighting can make a big difference. One of the challenges we face is that screen use is deeply embedded in modern life. Children are using tablets for schoolwork, adults are working remotely, and even social interactions now happen through screens. Patients often don't realize that symptoms like dry eyes or headaches may be linked to their screen habits. That's why we emphasize regular eye exams, especially for those who spend more than 4 hours a day on screens. We also encourage parents to monitor children's screen time and ensure they take breaks, maintain good posture, and avoid screens at least an hour before bedtime. Preventive care is essential in managing screen-related eye issues. We now know that children's eyes are particularly vulnerable because their visual systems are still developing. Excessive screen time in early childhood has been associated with increased risk of myopia, nearsightedness, which is rising at an alarming rate globally. That's why we advocate for outdoor play, which has been shown to reduce the risk of myopia progression. For adults, preventive strategies include workplace ergonomics, blue light filtering glasses, and digital wellness habits that prioritize eye health. In terms of treatment, most cases of digital eye strain can be managed with behavioral changes and supportive care. Artificial tears can help relieve dryness, while prescription glasses with anti-reflective coatings may improve visual comfort. In some cases, vision therapy may be recommended to improve focusing ability and eye coordination. Emerging technologies, such as screen time tracking apps and smart glasses that adjust tint based on lighting, are also being explored to support visual health. But ultimately, the most effective intervention is awareness, helping patients understand that their daily habits directly impact their eye health. Looking ahead, we must continue to adapt our clinical practices to the digital age. As screen use becomes even more integrated into daily life, we'll need to develop new guidelines, tools, and educational strategies to protect visual health across all age groups. Our goal should be to empower patients with the knowledge and habits they need to use screens wisely, because digital convenience should never come at the cost of long-term vision.